All right. Hey, everybody. Dr. Patel here, streaming live from my balcony at home. Um, Working from home today because all I was doing was telemedicine, and that I can do from home. Hope everyone's doing really well. Um, this is just going to be a quick little thing. Had some questions this week from some patients about the concept of tendinitis. So I'm here today to describe what is tendinitis, what is tendinopathy or tendinosis, what's the difference between all of these, and ultimately what can be done about it. So first of all, what is a tendon? A tendon is what attaches muscle to bone. A tendon is a soft tissue structure, and it's what's in charge of essentially pulling the bone so movement can take place. Right? Tendon, the fibers of the tendon, the way that I like to describe this to patients is that the fibers of the tendon are all kind of parallel. If you could picture this, picture the bristles of a paintbrush. That's what tendon fibers are like. They're all parallel, they're nice and compact, and a nice healthy tendon, all of those tendon fibers move in sync. But as we get older in general, sometimes those tendon fibers can start to get a little bit frayed, or if we have overuse injuries, or if we're doing things that's causing pressure on these tendons, those fibers can start to get irritated. And what happens is those fibers can start to get disorganized, so they can start to go in different directions. So picture a paintbrush again, and take that paintbrush, dip it into paint, and leave it overnight, right? What happens? All those bristles are kind of matted and crusted and stuck together. That's called tendinopathy or tendinosis. Now, that disorganized fiber of the tendon, that does not necessarily have to equal pain. In fact, it is very common for us to have that and have zero pain associated with it. But those fibers can then get irritated if we put abnormal stretch into it, if we do something funky to pull on those tendons, if we get injured, if we fall, etc. Various different things can cause injury or irritation to those tendons. So what are the different things that can happen then to those tendons? If you could picture those bristles all kind of matted and crusted and going in different directions from that matted paintbrush, if you picture that, those clumped bristles, then you can imagine sometimes that there's gaps that form in between those bristles. Those are called degenerative tears. Again, this doesn't necessarily have to equal pain, but this could be something that causes pain. And furthermore, if we have an injury, if we're, pulling our arm and our shoulder gets injured, if we are throwing something, or if we're swinging a tennis racket and our elbow gets injured, then sometimes some of those bristles can actually break off, and that's called a tear. If more significant number of bristles break off, that's more significant of a tear. And sometimes those bristles can kind of break off just a little bit. Sometimes those bristles can break off and completely retract or go backwards, forming a gap, and that's obviously more severe. Now, even if those bristles do not break off, we can get irritation to this area, and that inflammation that is caused around a tendon is what's called tendinitis. Sometimes these tendons, where they attach onto bone, there's little sacs of fluid that provide some cushion and support to those areas. If there's irritation to those tendons, if there's something going on, then those little sacs of fluid can get inflamed. Those sacs of fluid are called bursa, and that inflammation of that sac can then be called a bursitis. So ultimately, these are the different things that could be involved with an injury to a tendon, which again is the soft tissue structure that attaches muscle to bone. So what do we do about it, right? Very common tendon injuries that I see in my clinic and that I hear about all the time are injuries to the rotator cuff tendons, or injuries to the tendon at the elbow, what's familiarly called tennis elbow, or injuries to the tendon that attaches at the heel from the calf, which is called the Achilles tendon, or even injuries to the tendon in the front of the knee called the patellar tendon, which a lot of people call jumper's knee. So what happens when we have these type of injuries? If it's just a little irritation to the tendon, oftentimes the appropriate management and treatment is actually exercise. Doing the right exercise, getting the body moving correctly, can oftentimes improve that tendon quite a bit. In fact, there are certain exercise protocols for the Achilles tendon, for example, using what's called eccentric strengthening, basically gradually elongating that tendon under weight, can actually help with reorganizing those tendon fibers, get those tendon firing properly and improve pain. What happens if exercise is not enough? Well, honestly, I oftentimes send patients to physical therapy to make sure that the exercises are being done correctly. And also, we also want to make sure that it's not just the area that has the pain that we're addressing, because let's say it is an injury to the patellar tendon of the knee, we have to make sure that the muscles of the butt are firing properly. We got to make sure that the core muscles are firing properly, because only then can we know that the knees are moving the way that they should be moving. I don't typically recommend the non-steroidal anti-inflammatory drugs for this type of condition. So that's your ibuprofen, Motrin, Aleve, Advil, naproxen, Voltaren. These kind of medications decrease pain by decreasing inflammation, but in decreasing inflammation, they also may actually decrease the healing process. Couple reasons. Number one, inflammation itself may actually be a good thing. When we have an acute tendon injury, if it's not a significant tear, if you have a little bit of inflammation, it is normal for us to have inflammation for a few days. It is normal for there to be a little bit of swelling at some times, and it's normal for that inflammation to come and then go. So that inflammation is actually the first part of the healing process. So if we take a medication that's then going to stop that inflammation, we're setting ourselves up for improper healing of that tendon to take place. Really important concept. So if we have pain that's not manageable, taking something like Tylenol may be perfectly fine. If we have swelling that's excessive, or you have pain that's really bothersome, putting on ice to decrease some of that inflammation, but not completely eliminating it with a medication like an NSAID. There are some anti-inflammatory supplements that might be beneficial. Not a lot of research on these for tendinopathy, but theoretically these may be able to decrease the excess inflammation without getting in the way of the healing process. Another reason that NSAIDs like ibuprofen, Motrin, etc. are not the greatest for a tendon injury is that these NSAIDs may actually interfere with the collagen synthesis. So this is an important part of healing and something that we have to keep in mind. So if, let's say, the exercise, the ice, etc. does not work, what's the most common thing that most people do when they get into a physician's office for this type of injury? It's actually a cortisone injection. Now this gets really dicey. A cortisone injection or corticosteroid injection is an injection of a steroid that then decreases inflammation. But first and foremost, we got to make sure that there's actually some inflammation there to decrease. So sometimes, let's say the rotator cuff, the injury is actually associated with an irritation to the cuff because of the way that we're moving, and not necessarily a robust inflammation that's going on. So if there's not inflammation, why use a steroid to decrease the inflammation? This is an especially important question because we have to outweigh the benefits and the risks of all types of treatments, and a steroid injection around tendon may actually, again, not only interfere with healing, but particularly with tendons, can actually cause tendons to get worse. This is especially true if we're not using image guidance in order to do the injection. So what do I mean by that? A lot of times if you go to your primary care doc, or even if you go to your orthopedic doc to get these cortisone injections, you'll get an injection by what's called surface palpation. or what's colloquially called a blind injection. The doctor will press along different landmarks and then inject based off of what should be theoretically a safe way of injecting. This is what's been historically done. This is the way that I learned how to do injections initially in my training. But ultimately, that we can't say 100% if that injection is getting where it needs to go. This is important with tendon injuries because if we are dealing with some tearing of the tendon, and if we, by mistake, inadvertently put cortisone into that tendon itself, that could actually cause a tendon rupture. We've seen this time and time again. I have had several patients at this juncture complain about pain in the front of their shoulder. They got a cortisone injection in the front of their shoulder at what's called the biceps tendon, which is the tendon that goes to their biceps muscle. That actually caused a tendon rupture. So it's really, really important for us, if we are going to go down the route of a cortisone injection to decrease any inflammation, to have that done with ultrasound guidance so we can see exactly where we're going. That being said, since cortisone has side effects associated with it, including the risk of potentially making it worse, the thing that I use for a lot of tendon injuries is using a patient's own blood growth factors called PRP, or platelet-rich plasma. This platelet-rich plasma can be beneficial for decreasing inflammation and decreasing pain, but for certain tendon conditions, we've even seen tendon fibers actually look better when there's not significant tearing going on. If and when there's significant tearing going on, then PRP is not enough. If there is some tearing, but not a significant chunk of tearing, then sometimes using a patient's own bone marrow aspirated cells, or using even a graft from the patient's own fat might be beneficial for improving the strength of tendons, providing some level of healing, and decreasing pain associated with it. But ultimately, the research is still all over the place, and we're still learning a lot about these treatments. The good thing about it, the downside of these treatments is very, very low in comparison to the potential upside of it. And this is not an irreversible thing. This is an injection treatment using a patient's own body's healing growth factors or cells. This is not an irreversible surgery that has its own risks associated with it. Now, if there is significant tearing that can't be properly treated with orthobiologics, let's say we have a rotator cuff tear that has a tear, and that tear has been retracted. There's a gap of space between those fibers of tendon. Ain't no amount of injections I can do to get those fibers to come back together, right? So in that kind of setting, a surgery is reasonable, is appropriate to sew those pieces of tendon fibers together. But rotator cuff repair surgeries, why is it that there's so many re-tears that occur after the rotator cuff repair surgery? So if we think about it, what caused the tear over time is that the tendon had been degenerating over time. Those tendon had some frayed edges. It wasn't the healthiest of tendons in the first place, and then some sort of trauma or injury caused those fibers to break apart. So if you go and sew those pieces of tendon together, then an analogy one of my mentors taught me is that it's like you're sewing together two pieces of wet toilet paper. The chance of that re-tearing is actually very high. So there's some interesting research out of Europe. One of the forefathers of regenerative medicine, Dr. Felipe Hernigue, published some long-term data showing that if you do that rotator cuff repair surgery and include bone marrow cells in that process, then there's a lesser re-tear rate, and there's actually a faster recovery time associated with that. And we've seen similar things in our clinic. So if I have a patient that is contemplating surgery but still trying to avoid it, sometimes we try to use an orthobiologic, but then if they end up having to do surgery afterwards, theoretically we're strengthening those fibers that are then going to be repaired. Likewise, if a patient absolutely needs surgery, we can follow that up with using a patient's own healing growth factors in order to speed up the healing process and prevent a re-tear. So really important concepts to consider. The truth is there's a lot of different treatment options for tendon injuries. Tendon, to recap, is the soft tissue structure that connects muscle to bone. Those fibers can disorganize or degenerate over time, and various different things can go wrong in terms of causing pain in those areas. But we do have to be careful about our treatment options. Physical therapy and exercise is oftentimes the main number one thing. We have to be careful about things like nonsteroidal anti-inflammatory drugs and cortisone. Surgery is a reasonable option in many circumstances, and sometimes surgery can be avoided with using a patient's own growth factors. So if you do have a tendon injury, if you have issues with these, and you've been either treated with NSAIDs or cortisone injections, or that has been suggested to you, reach out. If you have been suggested to have surgery but you're a little bit confused or you're a little bit wary, reach out. You can comment, DM, message my education center at info@stemcelldrpatel.com. Be more than happy to look over your situation and say, are you or are you not a candidate for these orthobiologic procedures? Is surgery the best option for you? Or is it simple enough that we just need to go through some solid physical therapy and get moving properly to get you where you need to be? So if you do have pain in your shoulder, your elbow, your ankle, your knee, if you have something that's bothering you, don't wait. If there's something that's lingering, if it's sticking around, don't wait until that simple tendinopathy becomes more of a significant tear. Let's get that checked out. Let's get you moving properly, and let's get you doing the things that you love to do. Hope you enjoyed this. Sort of really quick tidbit here. Next week we'll go into more detail on some other topics. If you are one of my patients, or if you're not, drop us a line, email us if there's a specific topic that you want to talk about. I'd be more than happy to cover it. Hit us up when you get a chance, and I hope you guys have a great weekend.